With rising costs and confusing options, it can be hard to know if you're actually getting value for money when it comes to your health insurance.
Here to help make sense of it all is health insurance expert Dermot Goode from Health Insurance Ireland. Dermot, thank you so much for joining us.
Good morning.
Just right now, if you want to get in contact, you're going to stay and answer some questions as well. 0896 111 111 if you've got some questions about health insurance. Dermot, every time I open the paper, at least once a month, it's health insurance increasing again in Ireland. We have had numerous, and it's across all of them, that they're going up. All in conjunction, one goes up one month, one goes up the next month. What's going on?
Well, there's a number of things happening. So claims are spiralling. So what's actually happening is the volume and the cost of claims, they really haven't got a full control on that as of yet. And that's why we're seeing rates going up at least twice a year. And where consumers are getting caught out is, number one, they're listening to the average figure. So they hear an average of 4%, 4.5%. But when I looked at the last increase with some of the plans, it was actually 12%. So people are being misled by the average figure. And then the other thing is they're forgetting rates already went up in March or April. So there's actually, for the 500,000 people now who are going to get the renewal notices in 2 weeks' time, because the 1st of January is the busiest period for renewals, they're facing increases now. The cumulative increase, if they're lucky, maybe less than 10%. Most people on popular plans, about 15%. But for a lot of older members who are still sitting on the really old, dated plans, and they're facing increases potentially of up to 25, 27%. So, yeah, there's a lot of...
What? That's a
lot of shock.
27% increase in 1 year.
In 1 year. And just to extrapolate that, so, for example, imagine if you're on a plan that's going up 25% in 1 year, but you've been on that plan for the last 10 to 15 years, you've been hit by every price increase over that period. And that's what I'm trying to make people aware of. As we get into the busy period, when all those renewals are falling, if you're on the same plan for 5, 10, 15 years, you know, not only can you avoid the latest increase, you can potentially, in some cases, you can halve your costs by just moving to a more up-to-date plan.
By not sort of just rolling it over. So contact it. So 500,000 people over the next 2 weeks.
This is...
What is it? It was just, January is the start of the year?
Yeah, a lot of people historically wanted their health insurance year to coincide with the tax year. And going right back to 2011, when VHI had a big increase, back then they were bringing in a big increase in February. We told everybody to change your renewal date to the 1st of January to avoid the increase. But then they brought in these annual contracts. So now everybody's locked in with a 1st of January renewal. So it is the single busiest time, and it's the worst time of the year because, you know, everybody's preoccupied from the middle of December to the middle of January, and before they know it, they see the next deduction has gone out of their bank account.
What should we do then? What should we do if it's coming up for renewal?
The best advice to everybody is make one phone call to your health insurance company. One phone call, and all you do is just sit back with a mug of coffee and you tell them, you know, it's unaffordable, it's too expensive. Now, I want you to find me the closest plan that gives me similar benefits. Never use the word identical because they don't have identical plans that are cheaper. So something similar that gives me similar cover, and don't be afraid to tell them what your budget is. So if I got a bill now of €4,000 and I can only afford 2,500, tell them that. Because then, and you just sit back, now they have to look through all their 150 plans to see can they find you something that matches that budget.
Some people mightn't be, right, they could be on something that's called the best plan for you and mightn't be aware of what they're on, right? Do you know, some people are very into health insurance, some people are like, I have it, I should be okay. But you've identified 35 health insurance plans that are kind of big health insurance plans that people might be on where there's no longer value.
Yes, so I'm always looking at the plans and the rate increases and how they compare to other plans. Because of the sizable increases that are coming consumers' way, when I looked at that and then looked at some of the older plans, like some of the increases now are between €500 and €955 per adult. So, and then I looked at the date of the plan. So yes, there's about 35 plans that was covered. I think Charlie Weston had it in his article. And on those 35 plans, a lot of those plans are in the market 10 to 15 years. 2 of them I recognise from my days in Bupa Ireland. They're on the market 20 years. Now, not to alarm people, these are good plans. They're just, in my view, not good value.
They're not good value now. Exactly. So 1,840 is the average premium. So if you're paying
Take us out, 1,840 in a country that is meant to have free healthcare.
But at the same time, if you want your private health insurance, that's your average premium. So if you're paying that, are you on a good plan or should you try and increase it a little bit to be on a better plan?
If you're paying that kind of money, you should be on very good cover.
OK.
Yeah, so
if you're paying that around that figure, you should be getting good good cover.
Like what I would say, the indicators for me, Alan, of people who maybe are on the wrong plan. If you're on the same plan for 5, 10 years or more, the longer you're on the same plan, the higher the likelihood you're overpaying. If you're paying more than €2,500 per adult, there needs to be a very clear reason. And for a lot of people, there is. They want a private room.
Yes.
A lot of people want full cover for the hip and knee and shoulder replacements. Those plans
are
exactly
that type of thing.
But for a lot of people, it's just because they auto-renew. And it's mostly the older people. They're terrified of changing their cover. They're afraid they won't be taken on by another insurer.
Exactly.
They'll have existing exclusions.
Yeah.
None of that applies. The legislation is so protective.
But if you
of
change
consumers.
company and you have an existing thing, an existing problem, will a new company take that on?
They have no choice. That's the legislation. So just to give an example.
What is this thing like, we'll take you, but if you have an existing problem, we won't cover that for 2 years or something like that?
So that's a very specific rule called the upgrade rule. And all that means is if Dermot Goode changes his cover to a better plan, I increase my cover today. If I'm healthy, I get the increased cover immediately. But if I have an existing condition, then they'll say to me, OK, Dermot, you've just increased your cover, but you have an existing problem. We won't give you the extra cover for that condition for 2 years, but we'll still pay you exactly what you would have got on your previous plan. So you're no worse off. And by the way, 50 to 60% of people who switch get a better deal with the same insurance company.
OK, so with the same insurance company, when it comes to insurance companies, we've got a few providers in Ireland, probably not as many as they do in other European countries, bringing the cost down of health insurance in other countries. Are they kind of all the same, or should we be looking at our providers?
We should, people should definitely shop around. I mean, look, you have VHI now, 1.2 million members. They've got about 87 plans. They have some amazing corporate plans that most people don't even know exist.
Yeah.
And then you have Leia Healthcare, which is now owned by AXA. They've got about 150 plans. They have plans to suit everybody's budget. You also have Irish Life Health. And you have the new provider, Level Health, who actually is just now their anniversary. They're in the market 12 months. And by the way, for anybody listening to this who has a young family, like on the 1st of January, Leia Healthcare will bring in a deal where you get your second, third, fourth, fifth child insured for free if you wish. And right now, Level Health, they have a deal where any kids under the age of 3, on all their plans, they're free. And on certain plans, any kids between 3 and 17, you get a 50% discount. But if you don't phone up and engage with the insurance companies, you're going to miss these deals.
Can I ask you, are these insurance companies telling people about these deals? Because I didn't know about that.
To be fair, they are. But the difficulty is you have so many plans renewing at this time. And here's what human nature is. What people do is when they get the details from the insurance company, it'll have details on benefit changes and alternative plans. All we look at is the figure. How much has it gone up by?
How much?
And I'd suggest you're sitting down when you open that renewal because it's going to be shocking for some people.